Today our topic is principles of community health nursing. So as a community health nurse, the nurse should maintain the principles of community health nursing. During community visit, during the care of community people, the nurse should maintain the principles. So the principles are: first is meet the community. It is the first necessary to meet the community in order to establish contact between community leaders, existing institutions, and obtain consent of the local leaders for a baseline survey. The first principle of community health nursing is to meet the community people and identify the needs of the community people and build a good interpersonal relationship. So through these principles, the nurse identify the needs of the community people and build a good personal relationship, interpersonal relationship with the community people. So through this principle, the community health nurse obtain consent from the leaders of the community and get information about the community. So from the first principle, the community health nurse first meet the community people. Through this meeting, the community health nurse identified their health problems, health needs, and build a good interpersonal relationship and contact with the community people and contact with the community leaders. From there, she take consent and get information regarding the community people. So the next principles is identification of health problems and needs. Various approaches may be used to identify the community health problems and health needs. So they include baseline survey, scrutinizing the records of the primary health center and sub-center. Questions regarding diseases common in area like birth, death, disabilities, etc. So the next principle is identification of health problems and needs. So from the first principle, that is meet the community. After meeting, the community health nurse identify the health problems and needs. So basically from the second principle, the community health nurse identify the health issues among the community people and scrutinizing and elaborating the records of primary health center and sub center where the community people all health records are recorded. So from there, community health nurse identify the birth history, the death history, main events, vital statistics like birth, death, disabilities. Those are identified or the community health nurse gets from sub-center or PHC, primary health center. And from the second principles, the community health nurse basically identify the health issues which gone through to the community peoples, among the community peoples. The third principle is setting priorities among health problems. So after identification of health problems and needs of the community people, the community health nurse then make a plan where she makes a hierarchy where the most important problems to least important problems are marked. Means she makes a hierarchy. Means the most important problem which is solved as soon as possible. So these problems are solved first, then the least problems are next. According to the priority, she makes a hierarchy of the problem which should be solved first. So in third principle, setting priorities among health problems. So during during make a hierarchy, that is most important problem to least important problem, the nurse should maintain 4 criteria to make this hierarchy. The first criteria is frequency. Frequency means with which the problem occurs, means how much time, the, the number of problems, how much population is affected, how much population is affected by the disease or by the problem, that is frequency. Next is seriousness of the problem of individuals and society. So the health problem is how much serious for the community people. So the next criteria is seriousness. The third criteria is urgency of the problem. And the last criteria is, fourth criteria is feasibility. Feasibility means availability. To control the problem within the financial resource limitations. Feasibility means availability of the resource like financial, manpower, materials, etc. Means in feasibility, to solve the problem, the resources which is needed to solve the problem, the resources is available or not. So according to that, the nurse should make a hierarchy of the problem. To solve the problem, how much manpower, how much medicines, how much financial power is needed, that should be available or not. According to that, the nurse should make a hierarchy. So that is the 4 criteria. First is frequency, next is seriousness, third is feasibility and urgency of the problem. According to that, the nurse setting the priority of the health problems among the community people. The last principle is planning and problem solving. So first is meet the community, next is identification of the need and health problems, third is setting priority of the health problem, and last is planning and problem solving. So having recognized that a problem or need exists, the community health nurse must decide what action should be taken by the health team. So after identification of the health problem, after making hierarchy of the health problem, the last is planning and problem solving. Planning of the actions that is needed to solve the health problem, actions which is needed to solve a particular health problem, that should be planned, and after that the implementation and problem solving is done. So in planning phase, in planning principle, then after identification of health problem, after prioritizing the health problem, the nurse should make a plan or action plan which is needed to solve the problem, that is jot down. And after that, after the planning, the nurse should implement the planning of the actions which is planned before, that is implemented, and after that problem is solved or not, that is evaluated. So after planning and problem solving, after implementation of the action plan, the nurse should evaluate the actions which is done by nurse, is it effective or not. So after the implementation, the nurse should evaluate his or her actions is effective for the community people or not, or how much effective. So it should be evaluated. So those are the important principles that should be kept in mind in community health nurse during her care.